Hello friends, today let us see the difference between physiological and pathological jaundice. So what is jaundice? It is a condition in which there is yellow discoloration of skin, sclera and other body tissues caused by presence of an excessive amount of bilirubin in the plasma and tissue fluids. So I hope you know what is bilirubin. It is a bile pigment. Normal levels of bilirubin in adults is 0.2 to 0.8 milligrams per deciliter, and clinically jaundice occurs when serum bilirubin exceeds 2 milligrams per deciliter. Now let us see what are the differences. Physiological jaundice appears after 24 hours of birth, most commonly on second or third day. In case of pathological jaundice, it appears within 24 hours of birth. In physiological jaundice, it starts on second day, reaches a peak on fifth day, and then gradually disappears. Here I said reaches a peak. It means the severity of the condition increases on fifth day and then gradually disappears. But here it starts within 24 hours, reaches a peak and persists for 2 to 3 weeks. So unlike physiological jaundice, it does not disappear. It lasts for 2 to 3 weeks. In physiological jaundice, bilirubin level gradually increases, that means in a slow way. Here in pathological jaundice, bilirubin level increases rapidly. Here in physiological jaundice, bilirubin levels reaches up to less than or equal to 0.5 grams per deciliter, whereas in pathological jaundice, bilirubin levels reaches up to greater than or equal to 0.5 grams per deciliter. In physiological jaundice, there is decreased conjugated hyperbilirubinemia. Friends, you read this carefully. Decreased conjugated hyperbilirubinemia, which means hyperbilirubinemia means increased amount of bilirubin in blood. So here what I said, conjugated hyperbilirubinemia, that means conjugated bilirubin is decreased. Indirectly what it means, here the conjugation of bilirubin is defective. So conjugated bilirubin is decreased, whereas there is increased unconjugated bilirubin in blood. So here there is increased conjugated hyperbilirubinemia, where in pathological jaundice the conjugation of bilirubin is taking place and the conjugated bilirubin is formed, but it is not being excreted. Instead of that, it is being accumulated in the blood. Physiological jaundice occurs in the conditions known as breastfeeding jaundice, breast milk jaundice, or Rh incompatibility. Whereas pathological jaundice occurs in neonatal hepatitis, cholestasis, biliary atresia, or in Budd-Chiari syndrome, which is in which post-vena cava atresia occurs. So when we come to treatment part, in physiological jaundice, phototherapy is the treatment for physiological jaundice. It is the ultimate one. Whereas in pathological jaundice, there is no perfect treatment for pathological jaundice. It may be conservative or invasive, which depends on the pathology. Conservative means by use of medications. Invasive by surgical procedures. Like in case of cholestasis, there should be a surgery performed. So let us see what phototherapy is. See, as you can see, a baby is placed under light, which is known as ultraviolet light. This is phototherapy. The setup uses ultraviolet light of wavelength 512 nanometers, which is a peculiar range of wavelength. As you can see, what are the precautions to be taken in phototherapy? The baby's eyes should be covered and the genitalia should be covered. Why? We should cover the eyes to prevent the retinal damage, as UV light damages the retina and UV light causes gonadal dysgenesis in newborns. That's why the genitalia is covered. So friends, if you find this video informative, please give it a like and subscribe to my channel for more new videos. This is Chaitanya signing off.